Hello, my name is Ashley Bailey. I'm here today with my group members Lisa Lavelle and Laura Madden. We are bringing you today our Change Project, which is titled Verification of Legal Guardianship for Surgical Pediatric Patients in the PACU at Methodist Hospital.
Hi, my name is Lisa Lavelle, and I wanted to tell you that according to the Washington Post, 126 children under the age of 6 months were abducted from hospitals during the years 1993 through 2006. Infant abductions are rare, and almost 80% of child abductions are not by strangers, but by family members. The latest U.S. Census revealed that less than 59% of our nation's children live with both biological parents that are married to each other. Over 200,000 children are kidnapped each year by family members seeking to interfere with parental visitation rights. In our ever-changing society, it's no longer realistic to assume that the person that enters the PACU to claim the pediatric patient is the legal guardian of that patient or the custodial parent. In Provision 3 of the Code of Ethics for Nurses, standards call for nurses to promote the welfare, health, and safety of the patients we serve, and to advocate on the patient's behalf whenever necessary. Furthermore, JCAHO's 2012 Hospital National Patient Safety Goals were established to help hospitals address areas of concern in regarding to patient safety. The abduction of any patient receiving care, treatment, or services, or the discharge of an infant or child to the wrong family is considered by JCAHO a reviewable sentinel event. We chose this project because verifying parents or legal guardians is not a problem for the pre-op staff, since the parent or the legal guardian is usually the one that brings the child in for admission to the unit. It's only after the child is taken to surgery and separated from that parent that the safety risk increases. After surgery, the child is brought to PACU for post-op recovery. Surgery is emotionally traumatic for everyone, but especially for the pediatric patient. Separation from his or her parents or legal guardian, the trauma of the surgery, pain, the effects of anesthesia and narcotics more often than not result in a crying, inconsolable child. The goal of the PACU staff is to reunite the child with his or her parent or legal guardian as soon as is safely possible to help soothe the child. Once the child has met criteria, he or she may be transferred to step down for phase 2 recovery. At that time, the waiting room is notified and the family of the patient is sent to the unit to be reunited with their child. This is the point that poses the greatest potential safety issue for these young patients. The PACU staff has not seen the child or the family before surgery. When the family is admitted to the step-down unit, the PACU staff can only assume that the person holding out their arms to take the screaming child is actually the parent or legal guardian of that child. Now, one might think that the child would not just go to a stranger, but I have seen a screaming child reach out for another nurse that's just walking by and be calmed when that nurse holds out her arms and takes them. Also, I have witnessed children that are so distraught that even family members cannot soothe them. Once again, the staff can only assume that the child is screaming and is distraught over the surgical procedure and that we haven't just handed him over to a stranger. To assure the safety of pediatric post-operative patients upon discharge from Methodist Hospital, the current surgical services recovery room policy at Methodist Hospital was revised to include procedures for verifying the legal parent or guardian of the surgical pediatric patient prior to phase 2 discharge.
The next three slides are evidence tables. We reviewed approximately 15 literary sources. We found an abundant information about different facilities, how they call what we call a code pink, which is the #1 code for an abducted child. We also found lots of information about the abductions of infants and newborns. However, there is not very much information about older children being abducted from hospitals. And although our educated guess was that this doesn't occur often enough to actually have a lot of literature about it. However, remember, it just takes that one time for an abduction to occur to cause a huge problem. According to the National Center for Missing and Exploited Children, there were 279 abductions of children under the age of 6 months old by a non-family member from the years of 1983 to 2006. 128 of these abductions were from healthcare facilities alone. 112 occurred in the home, and this is the chart behind me, and 39 occurred from other places such as parks or grocery stores or somewhere else in the public. Of these 128 abductions from healthcare facility, 74 occurred from the mother's room. We are assuming that those are infants. 17 from the nursery, 17 from a pediatrics unit, and 20 from somewhere else on the premises. So the second largest amount abducted were from somewhere else on the premises, which could include a PACU. 10 of these incidences included violence to the mother or caregiver. 123 of these abducted children have been found, yet 5 are still missing. 4 of these cases actually occurred in the state of Kentucky. And although, as I said, although most of the literature suggests that abductions occur in newborns or in infants, there is data to show that abductions do occur in other areas, such as a PACU, and to older children other than infants.
Okay, possible approaches to the identified problem. The problem was presented to the Methodist Hospital Surgical Service managerial staff about the proposed project that we would like to revise. We revised the current discharge policy when the patient is discharged home after surgery in outpatient or recovery room. The staff was educated on the new policy and procedure that we were wanting to implement with the name band verification of the patient and the family before they're discharged home and before surgery. Frontline staff were identified, the legal guardian of the patient and the family member before surgery, according to the name bands that were put on them before surgery and after the surgery was over. The frontline staff to use state-issued ID. If there was any question about the legal guardianship of this child in PACU or before they go to surgery, there may be possibly a driver's license or a photo ID with a social security number or something like that on the card to identify the legal guardian of the child, to make sure there wasn't any possible abduction that would be a possibility. The staff to use patient ID band. Like I said, before surgery they would have this armband on with various information on that only the legal guardian would know in the hospital, and they would match the one with the child, and the child would not be taking this name band off, or the family member before surgery or after surgery. Sometimes the nurses have not even seen the family member before surgery, and when the patient comes back from surgery, they check the armbands and they must match before the child can even be going anywhere with the new person that's come to see them, to risk the abduction. The data was analyzed in the process of making this policy implemented. There were several issues that we had to analyze and go through before management would look at the provisions that we were wanting to do. Patients were to wear the security bracelet similar to the other identification bracelet in the hospital. As long as they're in the pediatric unit, the armbands would remain on the patient and with the family member. The proposed strategy, there was a meeting conducted with the surgical staff and the management staff on the possibility of this new policy and procedure that would be implemented, the armband verification. There were revisions done with the policy. There was meeting and discussions with surgical services and staff on the current discharge policy according to the name bands. Make sure everything was correct on them and who was there was supposed to pick up the patient and take home. And if they weren't, then we had to investigate it before they could leave with them. And we also did an audit, a possible audit for possibly about a month after this is implemented. Then go through the patient's chart and make sure on Meditech that there was the flow sheet, that the armbands were checked prior to surgery and when they were discharged to make sure it's compliance with the policy that was implemented. Our project objects, surgical services, recovery room at Methodist revised to include verification of legal parent guardianship of the surgical pediatric patient upon phase 2 of discharge. That reduces the risk of reduction of the patient. You have to make sure this patient goes with who it's supposed to, because there will be a lot of legal issues, and it'll also be bad publicity for the hospital and legal actions from the legal guardian of the patient. An in-service was done with the staff prior to the policy change. If there was any questions on the new policy that would to be revised, they would be answered, and management would implement the new policy when all the new changes would be developed. Like I said, analysis of the Meditech data will show at least 80% compliance rate of the policy change from the frontline staff. There is just to make sure there is no abductions to the best of our ability. Any patients leaving the hospital without legal guardianship or who is supposed to be taking them, because no one wants to come in the hospital and have their child have surgery and something happen to them or someone takes off with them. That would be a very bad thing for it to happen.
Okay, so to be just a little bit more specific, during our clinical project, the patient would be brought into the pre-op area with the parents. 2 additional label sheets, including armbands, would be printed. Up to two legal guardians will be identified, and then the armbands matching the patients will be applied. Of course, the patient will go to surgery, and then in the post-op phase, which Methodist Hospital actually calls recovery discharge phase 2. Before the family receives the patient, their armband will be verified by the discharge nurse or inspected by the discharge nurse, so to ensure that it matches the patient's. The discharging nurse will then document in the computerized medical records charting system called Meditech that they have verified this. This next screen actually shows the discharge screen. We were able to meet with the IT department at Methodist, and they put in they put a portion in on the discharge screen where the discharge nurse would click, yes, I verified that patient's, that was their legal guardian.
When we chose this project, we knew one of the challenges would be measuring the outcomes of our project and whether it was successful or not. Obviously, if no children are abducted, it's successful, but we needed something that we could measure. There's a logbook in step down that contains information for each patient that is admitted to step down, and in that information is a label that includes the patient's name. As a quality control review, what we did, and it was a way to analyze our outcome, is that we were able to go back through that logbook once the policy was implemented, and by using the patient control number, look up that patient's chart on the computer to see whether the discharge nurse charted that she had verified the patient's armband with the legal guardian's armband. What we did is we went back through, and on the document behind us, we were able to put the date and the patient control number and just verify yes or no if the charting was completed. As you can see, according to the data that we obtained from Methodist, the PACU frontline staff had an 83.3 rate of compliance on March 12th, and that was the first day that the new policy went into effect. Then their compliance rate decreased slightly to 80% on March 20th, and then up to 100% on March 22nd. There was no data from March 13th through 19th because pediatric surgical patients, surgery is not performed every day at Methodist, so we had a limited amount of data to look at. But as you can see, the more comfortable the frontline staff became with the new policy, the higher the rate of compliance became.
And with our evaluation of our new policy that was implemented, it was a success. The current policy was revised and implemented. In-services were conducted with the staff and management on the new policy and procedure with the armband verification. 100% compliance was done. The process was satisfactory. There was no change needed after we implemented it. Questions were asked and they were answered by staff and management on the new policy. The recommendations, Methodist Hospital staff to continue these procedures and with the managers to evaluate effectiveness and compliance. Everything seems to be going well. That reduces the risk of any children being abducted from the hospital, and it is a safety priority of the staff and the hospital that makes sure every child goes home with who they're supposed to, legal guardian or parent.